GvHD, now moving into a different setting, which is the allogeneic stem cell transplantation setting. Of course, GvHD has been, since the very beginning, one of the most important and relevant complications of the procedure, and it's one of the most important causes of morbidity and eventually mortality of those patients that are candidates for an allogeneic stem cell transplantation. We have to talk about GvHD prophylaxis, of course, trying to prevent GvHD, and of course, GvHD treatment. If we talk just a little bit about GvHD prophylaxis, I basically want to mention the role of cyclophosphamide post allogeneic stem cell transplantation. That it's really a very interesting and a very effective way of abrogating not only acute but chronic GvHD after transplant that was initially used in the setting of haploidentical stem cell transplantation, which has gained specific interest in the last few years. But now this concept of cyclopost that basically has the objective to kill the rapidly proliferating T-cell lymphocyte compartment, which is the responsible one for the GvHD, while preserving the dormant T-cell compartment, which is responsible for engraftment after transplant and for the graft versus leukemia effect. So this cyclopost has been transferred, or it's being used not only in the haploidentical donor setting, but also in the match and mismatch unrelated donor setting, and eventually in the HLA identical sibling donor setting. So this is one area that probably we will know more about it. What about the treatment of acute and chronic GvHD? So first-line treatment strategies are based on corticosteroids, but unfortunately, there are patients that are corticosteroid refractory. They represent a big unmet medical need. But nowadays, we have several drugs that basically are targeting different molecular pathways that have a clinical relevance in the development of acute and chronic GvHD that represent new hopes for the patients. Some of them, such as Ruxolitinib, on the basis of phase 3 prospective clinical trials, have already been approved by the regulatory agencies, and we are able to use them in our patients outside prospective clinical trials. But there are really new drugs that are bringing really exciting results, and that hopefully will be able to be used in the near future outside prospective clinical trials.